So I'd like to call the Mason County Board of Health regular meeting to order. And we will have introductions. So maybe if we just go around the table, starting.
I'm Diana Yu. I'm the Mason County Health Officer.
Kathy McDowell, Commissioner of Finance for the city.
Debbie Riley, Environmental Health Manager.
Eileen Bransfield with Public Hospital District Number 1.
And I'm Peggy Van Busker with Public Hospital District Number 2.
You get stumbled over
I
too,
know.
huh? Lydia Buchheit, Mason County Public Health and Human Services.
Frank Phillips, representing the fire commissioners for Mason County.
Here, Jeffries, Mason County Commission.
And we have a few public. So Kim Clint, retired now, Executive Director of Mason Matters.
Marilyn Vogler, a member of the public. Jeannie Raywald in, Mediator of
Yay.
Joe Sanchez, Community Health Educator, Mason County.
Well, you're going to clap for him too?
No, one retired, one's a new position.
Oh, okay. Randy Netherland, Mason County.
Okay. So, can I have a motion for the agenda?
My turn. Move that we approve the agenda.
Second.
All those in favor?
Aye.
And motion for the minutes?
Sure.
I'll move that we approve the minutes.
Second?
Second.
And any discussion? All those in favor?
Aye.
Okay. And Public Health Week. And I'm going to have you.
So the first week in April is always National Public Health Week, and we introduced Joe Sanchez, who is our new health educator, and so he's been doing some work on Public Health Week, and we tend in Mason County to do Public Health Month. We try to go beyond just the week, and so I'm going to let Joe share a few things about Public Health Week and what he's doing, and then we have a proclamation for it that he's going to read. And we also have a news release, and I wasn't sure, do we want to read the news release here or at the commission meeting for that? I didn't know the protocol for that. Both?
Yeah.
Okay. Okay. So I turn it over to Jim.
Yeah, so it's Public Health Week / Public Health Month, and there's kind of a website that guides us, but we can always do certain things in our community as a whole. Oh. And we'll be, decorating out here. I've got some ideas, and we'll be doing the take back boxes, the take back prescription box, and we'll be on the KMIS radio. They were giving us a week, but we got one slot now, so we're gonna, like Dr. Yu, we'll all strategize as to what we're gonna do there, and we're gonna be promoting health throughout the whole month. I mean, obviously we do that 24/7 in our jobs, but it's a good opportunity to get in people's ear and move them towards action. We've been from pre-contemplative to contemplative, whichever stage they're in. So, and so we've got a news release. Did you want me to read that now?
We'll just start with the proclamation first. So we have a proclamation for the commissioners, the Board of Health to completely sign.
Proclamation 2016 National Public Health Week and Mason County Public Health Month. Whereas the week of April 4th through 8th, 2016 is National Public Health Week, the theme Healthiest Nation 2030. Whereas since 1995, the American Public Health Association, through its sponsorship of National Public Health Week, has educated the public, policymakers, and public health professionals about issues important in improving the public's health. Whereas preventing disease before they start is critical to helping people live longer, healthier lives while managing health-related costs. Whereas the U.S. ranks last among 11 countries on measures of access, equity, quality, efficiency, and healthy lives. Whereas zip code, race, and class currently trumps genetic and health care as predictors of public health. Whereas community collaborations and partnerships are vital to improving community health and well-being. Now, therefore, the Mason County Board of Health does hereby proclaim the week of April 4th through 8th, 2016 as National Public Health Week 2016 in Mason County, and call upon the people of Mason County to observe this week by helping our families, friends, neighbors, coworkers, and leaders better understand the value of public health and adopt preventative lifestyle habits in light of this year's theme, Healthiest Nation 2030.
Thank you.
Thank you.
Do I have a motion?
To send it forward to the commission? Is that what you,
To approve it. To approve the,
The Board of Health usually signs this proclamation,
oh, okay.
because it's your proclamation to the community. the Board of
I
Health.
move that the Board of Health accept and sign this proclamation.
do I have a second?
I second it.
All those in favor?
Aye.
So now we'll get the news release.
Okay.
So I'm going to do an intro to
Sure.
the news release first, because it's going to tie right into Mason Matters and them talking about some of the changes in Mason Matters in the county health rankings, because the county health rankings were, national county health rankings were just released last week, so we're putting out now the news release on it. We wanted to bring it to the board first before we released it. And then Mason Matters is going to add more to it, so go ahead, Tim.
Okay, Mason County continues to move forward. Mason County once again has vaulted forward in the county health rankings and roadmaps for 2016. Ranked as low as 37th out of 39 counties during the rankings inception in 2010, the county has moved up to 29th in 2016. Since 2010, the rankings have helped expand the conversation about the broad range of factors that impact a community's overall health. These rankings measure vital health factors including high school graduation rates, obesity, smoking, unemployment, access to healthy foods, the quality of air and water, income, and teen births in nearly every county in America. They provide a revealing snapshot of how health is influenced by where we live, learn, work, and play. And they present a starting point for change in community. The goals of these rankings are to build awareness, help identify opportunities for sustainable health improvements and community change, and to connect and empower community leaders working to improve health. Data within the rankings fall into two major categories: health outcomes and health factors. Health outcomes is a combined measure of a county's average length of life and quality of life, a snapshot of today's current health status. In 2010, Mason County's health outcomes ranked 37th out of 39 counties. However, new ranking of 29 in 2016 demonstrates a Mason County trending in the right direction. The health factors ranking, which predicts the health of a county in the future, improved from 37th in 2015 to 32nd in 2016. As the county continues its strides forward, it leaves one to ask, can these positive changes be attributed to anything specific? Health is dynamic and complex. The county health rankings emphasize the many factors in population health that, if improved, can help make communities a healthier place to live, learn, work, and play. Health factors, for example, consist of many characteristics. These characteristics impact health factors at different rates. The physical environment, 10%, clinical care, 20%, health behaviors, 30%, and socioeconomic factors, 40%. There are evidence-based policies and programs that a community can implement to improve health factors and ultimately improve health outcomes. Smoking, for example, along with diet, exercise, alcohol use, and sexually active activity make up health behaviors. The Center for Disease Control and Prevention indicates that currently there are as many as 480,000 deaths per year linked to smoking. In Mason County, the percent of adults reported to be smokers fell to 16%, a 9% improvement when compared to the previous year's 5-year average of 25%. Because of its implications on smoking-related issues such as cancer and heart disease, declining smoking rates may continue to improve the county's rankings. In addition, social and economic factors such as unemployment rates fell to 8.4% compared to 9.7% in 2015. This marks the lowest unemployment rate since the rankings began in 2010. Children in poverty also fell an additional 4% from the year before to 24% overall. Other social influences possibly contributing to an improved rank are within the percent of children that graduate in 4 years. This number improved to 73% in 2016. And with the rate hovering at 67% over the past 3 years, a 6% improvement may shed some light on positive things happening in Mason County. Currently, a collective impact approach in which groups and organizations are encouraged to work with a common agenda, utilize continuous communications, and mutually reinforce a plan of action is a strategy being utilized to address health disparities. Collective impact efforts such as Mason County United Way, Mason County Early Learning Coalition, the Student Success Consortium, and Shelton Graduation Matters are utilizing this collective impact approach. Moving Mason Forward is another example of an all-inclusive community endeavor dedicated to community improvement, which can continue to help move Mason forward. Excuse me. The environment we live in, our social support system, the diet and exercise choices we make, socioeconomic status, and access to health care all play a role in our state of health. Each of these factors influences the overall health of a community and its residing citizens. Combined efforts from Mason County Public Health and Human Services, public policy improvements, public leadership, as well as community involvement can continue to help Mason County move forward in its overall county health rankings. For additional information, you can visit the county health rankings online at healthyrankings.org, or you can also contact Mason County Public Health and Human Services at 360-427-9670, extension 410, and also visit us online at healthymasoncounty.org. Thank you.
And welcome.
Yes.
When did you start?
February 16th.
Very new then.
Yes.
So then we're gonna have the Mason Matters update. I'm gonna bring your chair up, Jeannie. Stand, no.
No.
Here's the thing over here. Okay. So, just sharing that four people at this table are board members of Mason Matters, so sort of the information we're sharing is another chance for them to hear it again and start to crystallize it. So, I officially retired in December, but I've been staying on keeping things together until the board hires a new executive director, and that's Jeannie Raywall here. And she started yesterday, and
Threw it right in.
just threw it right in here. And my commitment to the board and the organization of the community is to help with coaching and transition, because I realized I really couldn't write anything down on a piece of paper and say, this is your job, go do it. And finishing off some initiatives that have started. So when I talked to Jean, I said, do you want to present or do you want me to present? And so she said, you talk about the new framework, and then she talked about that at Mason Matters board meeting, which is Thursday. There's going to be next steps and so to how to implement all this here. So it started a conversation in December and January of sort of what is Mason Matters' next initiative, and conversation with our sustaining funders, which, to remind everybody, is Public Hospital District number 1, Public Health Department, and this year Public Hospital District number 2 has agreed to provide some sustaining funds for Mason Matters. So our main government entities are demonstrating their support for Mason Matters with extra real dollars that keep the operation going. And some pieces that was trying to figure out, as public health is moving to the community health improvement plan, what might be a framework that can be used to guide it. So please know this is only a framework, because I want Jeannie to put, and the new board to put their footsteps on it, but I just didn't want to hand over a blank sheet of paper. And so that Mason Matters board agreed at a January meeting that it will be the leading organization, the coordinating organization for a community health improvement plan. And what that means is there's going to be some reorganizing, restructuring that I think will probably be targeted July 1st when we start a new fiscal year, and transitioning the membership and rethink about the governance and structure and the role of what Mason Matters will be doing
under this umbrella focusing on moving the community health improvement plan, or moving Mason forward. And some piece of that piece that sort of interconnects with you guys here at the Board of Health, and for those that have worked with me for 15 years, I really try not to make extra meetings and redundant meetings in people's lives. And one of the pieces that seem to make a little bit of sense is moving the elected officials, which has always been a county seat, a city seat, and the hospital, two hospital districts, hospital commissioner, not necessarily hospital district, over and having the Board of Health begin to work and think about what is the role of, and this is the question and I don't know the answer, but we have resources and tools to facilitate the conversation. What is the role of a Board of Health within the resources and perspectives that you bring to the table, Board of Health, in a broader community initiative of moving Mason forward? Obviously, you are not going to be in the weeds trying to figure out, should we do breastfeeding program A or breastfeeding program B? That knowledge goes to the experience and the experts in their community. But we believe that there's a really strong role for a Board of Health in trying to move this forward. And part of the work that I'm doing with the help of Lydia and brainstorming resources and then connecting up through Jeannie and working with Peggy, who will bring tools to this group, is really for the challenge for this group is to kind of figure out, so what is the role? It's not your only agenda item, but some part of the agenda for the Board of Health is saying, what is our unique role in trying to make Mason County the healthiest county? So what that means, we're moving Mason Matters board to really being a citizen-based board, trying to recruit people who have really broad perspectives and the best interest of the community at their forefront. And sort of not having people that come in with very narrow agendas and perspectives. There's a place for them in this model, but in terms of the board and the overarching piece, that we want really broad initiatives. Suggested to Jeannie, we talked really briefly with Peggy, because since Public Hospital District Number 2 is now a sustaining funder, we want to make sure it's not Mason Matters moving, and not Shelton Matters moving Shelton forward. So in that model, and maybe Randy and Peggy will be able to help figure out who are people we can invite in from the north end to join Mason Matters Board. We already have a little bit of short list, but you probably know them better. And then in this model and the struggle we have is we have a lot of really great work happening in this community, but we haven't had the resources to capture, document, celebrate all of that really great work. And so some piece that's the challenge for Jeannie, and not me anymore, is kind of figure out a structure to be able to make linkages between all the really great work that's happening in the community, and besides honoring the work and recognizing the good work, but trying to identify what are the missed opportunities and challenges that either a group, a citizen group like Mason Matters, can put a larger voice to the issue, and in a small piece is their potential role of a public health, of the Board of Health to be able to move that work forward. So the structure we're looking at, and you can probably know some of these, is sort of honoring the work that's being done, that's following collective impact approach. So I'll go to education, because we're talking about education. We have a very robust early learning coalition. They're strongly focusing on kindergarten readiness. And these are people, direct service providers, who are doing the work. The last thing we want them to do is to have to come to another meeting to talk about that. So Jeannie's challenge will be trying to figure out a structure that can link that work, so perhaps the outcomes of kindergarten readiness are connected into graduation, which is connected into workforce development. So we have all these pieces, and we want to make sure there's connection between them. I always use the example that people get. If somebody can't look at the whole, sometimes we have unintended sabotaging of each other's work plans. And the easiest example that I get that people get right away is food banks. Food banks are a really critical piece. We have a lot of people that don't have sufficient income to do. But if I asked Eileen about some of the issues they're facing at the hospital, I'm sure that diabetes and other chronic diseases is pretty high on their work list, and they're investing a lot of resources and taxpayer dollars to be able to address that particular issue. It doesn't make sense, and we used to be this way, we're not this way now, but when we used to go to the food bank, the poorest people who are in the biggest needs would get their food from the food bank, and the foods that the food banks tended to give were foodstuffs that were sabotaging the health directions that their coordinated care provider was giving them. So that, we use that as an example, so we say, you know, is the issue calories, or is the issue, where do we have opportunities to tweak food banks in such a way?
So you were talking that the food that they have at the food banks just kind of don't really do them any good.
It's probably
It's not nutritious enough.
yeah.
Okay.
So that is example. So when we kind of raise that issue, and this is an easy one because people can get that. So I think every food bank, with some of the work that WSU has done in other groups, is now linked with a community garden. So we know that fresh produce is coming. So that's a simple example way. I use the example of Pioneer Food Bank, which was a project that Mason Matters started. We started from scratch. So that group made a commitment to educate and not take, I called it, my words, not theirs, no ramen donation policy. So, and it wasn't saying, no, we're not going to take top ramen, but the verbiage and language they used to the community was about health. So when people were saying, we want to donate to the Pioneer Food Bank, they could give really specific examples to be able to say, if you give us cash, we can leverage that cash to buy protein meat. Or if you're standing at the shelves, where we call, and we partner with actually Pentecostal District number 1 on this, a guided food drive to say you have choice, so why don't you buy the low sodium cans of tomatoes and donate that rather than the regular sodium. So that's an example where we took one critical partner in our community who's, if we had arrows trying to move people to health, the kind of resources that they had were sabotaging another initiative we had in the community. That's really what we're looking at here, is if when these pockets of priority areas, where are the missed opportunities that we can't all tweak the work so we're moving agendas forward. And that's really the guidance that Mason Matters is starting to work on. It's not telling people what to do, not redirecting it, but posing maybe more interesting questions. Is there a way we can do this slightly differently in such a way that it supports another health initiative? And the piece around the Mason Matters board is ideally they're in a position to be able to capture all the pieces and to be able to go, Lydia, maybe if you were doing this and you never got to the meeting that Kathy's at, that if you tweaked your thing here, it'll help move something that Kathy's group is working on here. So it's that sort of having a broader perspective of the community and the work that we're all doing as committed citizens to that. So this is a new template. I should probably put draft on here because the new board and Jeannie are going to be shaping this the way that it works. But this is sort of the template I believe that Mason Matters board sort of approved is the work that's ahead for Mason Matters board. So is there any questions on that? Does that make sense?
A little story on that, though. I have an organization that I supply the meat for, but I also buy other stuff. I went in there because you have to bounce it off of what they also want, because I went in there and the person was telling me, oh, people just give us so much ramen, they give us so much of this and so much of that, and I went in there and I was asking the ladies, what would you like to have? What would be a treat?
Yeah.
You'd be shocked. We need more ramen. We need more stuff because our kids, that's what they eat. It's quick, it's simple. And I'm looking at her, she's shaking her head. You know? But that's a reality you have to bounce against.
So there's pieces, and I think Judy can talk about that. I think we've done a good job at the Pioneer Food Bank saying we admit that especially if people are using their own dollars and buying something at the grocery store and you have to feed your kids, I really pick on Top Ramen just because it's just so easy to be able to do that. But with the program that Jeannie was working at WSU and Food Sense, there's a way to take Top Ramen and add other things to it to make it an extended nutrition meal. And a lot of times that's the piece that gets missed is is we have to kind of realize, you're right, the reality is where people are at. But it doesn't mean that's where we stop.
I went and bought the cup of noodles
Okay.
because it had vegetables in it.
Kinda.
It's actually a good point. It's actually the
Kinda.
seasoning that is the problem.
Yeah.
All the
high sodium.
It's the high sodium. I've never seen
Yeah.
9-year-olds have hypertension as much as the 9-year-old that eats top ramen every day.
Yeah.
They have hypertension from all this.
So what we need to do is give some tools to you as a citizen saying, I want to help here, saying, so how can I, so maybe what I can do is pull the seasoning out and give some really healthy sauces, and that's what I'm going to be donating so they can extend. So, I mean, they're really basic things. And I use that as an example because people get it right away, but I could probably go through lots of work here and and it's not deliberate sabotage, it's just people don't know what other people are doing and don't know where they're bumping up against the pieces. So this is the model that Mason Matters will be moving in, and very confident with Jeannie that she will get the community and Mason Matters board, and then at whatever level is needed with this Board of Health to be thinking about that piece. What is our role of Board of Health in the larger goal of moving Mason forward to get some structure? So there's no other questions. So the last, I said this morning, gift when I was at the Board of Health, the gift I'm doing for the community is one of the things that Mason Matters does for our, particularly the hospital district number 1 and public health, is the data piece. It's one of the deliverables. The hospitals need it for their community benefit and on a different time frame than public health. So I'm updating the data. The last time we did that was in 2011, 2012, when community went through our CHA community health assessment. But I'm actually reorganizing them around this. So rather than having data spread all over the place, I'm trying to think about how to organize data to largely get any group of partners here to also be able to think deeper, to be able to unwrap the onion at a different level. So the one I brought you, and these are drafts, so you can see, so they're not complete. But my goal is to have these done for each of the 7 health priorities that we have, with goals, bringing to the groups that are doing the work the data that I think can be used to measure progress, that are data that are likely going to be here for a very long time. The hard thing about data pieces is somebody does a one-time study, and we go, oh, that really helps us understand something, and we're going to use that for baseline, and then there's no follow-up of collecting that data again. So it's an interesting balance on the indicators of finding data. But kind of moving you briefly through this, so you can look at it on your own, is we have a goal statement. Why do we pick education and employment? We have sort of the areas we're working on there in terms of the early learnings, working on the kindergarten readiness. The schools are working on not only getting kids to graduate from high school, but have them graduate college and career readiness. Having conversations with both the EDC and PAC Mountain around sort of, because our adult workforce also has to be, our existing adult workforce has to be ready for the job opportunities. And most importantly, our local economy has to be ideally providing living wage jobs so that people have opportunities for health. So you can see each of those things. It cannot be achieved by one organization doing the work. It takes that collective impact, broad thinking on it. So this is how the data are going to be organized with sort of what, and as I say, still in draft form, because these are my words, not the people that are doing the work. Some of them I know a little bit about, but still wordsmithing. And then most important, trying to find data or information to help people say, why is this happening? It's one, so I'll take kindergarten readiness as an example. And I did this with the Early Learning Coalition when I came and presented data with them. Saying, so when kids aren't kindergarten ready, what are some of the characteristics that you would, based upon research or your experience in the field, that you would predict? Kids that come from poverty, kids because they're not being exposed to as many words. There's dual languages. There's a lot of risk factors. And so with limited resources, you know, ideally the Early Learning Coalition wants to take the limited resources and put it where they're going to get the most bang for the buck to improve the rate. So if you look through this data, and I will challenge each of you, if you kind of look at some of those risk factors and think about our 7 school districts, most of you would probably believe that Hood Canal School District is the most at risk. It has the most amount of poverty. It has culture with our Native American cultural differences to the norm of the public school systems and other systems. But interesting, if you looked at the data at the next level, and this is an example of what I'm trying to leave so people can think differently, Hood Canal School District is doing the best, not the worst.
Where am I looking?
Which page?
So if you kind of looked at factors that inform education, page 4, and you had achievement areas, Hood Canal School District, between 84 and 88% of their students are walking into kindergarten ready. So the interesting question that I think that when we're doing community health improvement plan is think about, so what are we doing at Hood Canal that as community we can expand to an additional school district? Well, I do know some of the things out there. One, they have a Head Start, so every child that walks in, not every child, but 95% of the children that walk into there started with Head Start and they walk into kindergarten. And if you look at any of our other school districts, I'll say Pioneer has probably 0 kids because the bus drive to get somebody from Pioneer into the Head Start in Shelton is too long to meet the standards for those families to get there. So if you're doing something, thoughtful, maybe we need to do is be expanding early preschool opportunities out in Pioneer so those families and kids have an opportunity if they can't get in to Head Start. So I'm using that as kind of an example that we've kind of been challenging the Early Learning Coalition on that. And I think any one of the issues that Mason County is facing, there's always a deeper question that we need to be asking about. So if we have limited resources, where are we going to get the best bang for buck, and what is it that we need to be doing? So I guess my message behind this, I'm trying to organize the data to help the community and the CHIP be able to go, there's something else going on here. What is it? Can I ask the right questions, and can I find information to be able to deepen the conversation?
So what about Miriam Knight? It's 100% clear across.
Miriam Knight
Next one down.
Yeah, the next one down.
Oh, what that means is, those are 2 different measures there, but what that means, 100% of the kids came into Miriam Knight. Now you have to remember, they have a pretty small entry class.
Right. Right.
So there's a lot.
So they came
in
in, for the numbers, they came in 100% prepared.
Yeah.
Okay.
So, I wasn't needing to get into the deeper data here. I'm just trying to help you understand the tools and what the thinking
So
is.
I'm assuming that it's also, you talk about this data helping these groups think about how they're working. Perhaps this also would allow these groups to maybe, if they identify data sources, or know of ones that they would like to have added here.
Yeah.
With running the risk of not wanting to keep changing our data sources,
Right.
then you never have a baseline,
Yeah.
and you never have a comparable, and you don't know how you're doing.
In Insight Vision, we're trying to pick a few major data points that can be tracked long-term, but we also are going to encourage the different groups working on things to come up with other data pieces that they want to track. So yes, we're going to have both.
So it's something like, let's say living wage jobs. We may pick an indicator of what that is, but it may take 4 or 5 years to implement a policy and see a change. And so if you pick that as a data point and you see no progress, we don't want people to go, nothing's happening. So we're also encouraging the groups to find other data points that help understand progress that may not be, I'm using my academic things, robust measures that we need for measuring in the bigger picture, just because data come in lots of different ways. So these are drafts. My goal is to get some template of these out to partners in all one of these and asking them for feedback in terms of verbiage and everything, and that's my last big project for Mason Matters.
This is amazing. Someday I'd love to see what the data is that you produce for the hospitals as well, just to see what kind of things you guys are looking at.
I think my only comment on data, and thank you for bringing up the 100%. Percentages in and of
Yeah.
themselves we know can be misleading, so I like to see a table, or at least an N,
Okay,
that
yeah.
we know, the total N that the percentage was derived from.
Yeah.
I think that really provides more meaningful.
Yeah. So maybe I can do it as fractions, and it's a hard thing because you don't
Yeah.
want to overwhelm people with so
Right,
much data,
right.
so what's the balance sheet?
Or at least,
Yeah.
a reference table or something, so,
Yeah.
yeah, I think decisions based
Yeah.
on, the other thing that, and I personally am grateful to you for bringing that up, people, maybe it's the human condition. I know the problem is, fill in the blank, and when you do fact-based analysis, sometimes you're quite surprised.
Yeah.
Like you're doing Canal example.
Yeah. So,
And we get reports sometime from the state where we have a 50% decrease in something, and it's because one person.
yeah.
So we have to really look at our data carefully.
And in some pieces, some of those data, and there may be data on the county health rankings, we're so small that it,
It's not statistically significant.
yeah,
Yeah.
it is. So data are very challenging to present for community use because you're really trying to find that balance between making it accessible so that people can use it, but not making it so simple that people jump to very basic conclusions and miss the opportunity to go deeper.
I think one of the issues that we've talked about in the past has been the drug use, and that was one that we did not choose as a focus area, in particular, like one of the 7, but felt that it was something that was kind of sprinkled in among all of this, but I think it is significant, and I would love to see that data set in one of these.
Yeah.
We actually did change that. It is our 7th with behavioral health.
Okay.
It did only say behavioral health here, but it needs to say substance
Okay,
abuse too.
so, and these are shortcuts on
Yeah.
a verbiage and,
Yeah, so behavioral health, mental health, and substance abuse is together now in its own, so that it has its own focus, yeah.
Because that was the glaring
Yeah.
miss when I glanced at this paper.
Yeah.
So,
so Jeannie, before I talk about county health rankings a little more, I didn't know if you wanted to add something.
Just a little. So numbers are numbers, but stories are what really get to people and either make them feel like, hey, I want to jump in and help, or wow, we're doing really great, let's keep doing. So we will also be collecting stories from people, and our director at WSU Extension is really good at videotaping stories and coming up with apps so people can do as a place around where you're at. So there are a lot of other opportunities out there that will feed into the chip that will make sense to everyone, no matter where you're coming from.
I think there's a last piece. I just want to reemphasize that there is a role, I think, for the Board of Health here. And we just need to refine that over time. We'll be working on that. But it would feel really great to be able to have a role in all this. Well, we'll have an agenda item later that kind of indicates that it's not real clear cut what our role is. And it's because the community's been so active, truly. It's not a bad thing necessarily, but we're statutorily created, so we need to make sure that we are doing something in the building a healthier Mason County.
And it's more challenging, I think it's a huge asset, and I commend you of having an expanded Board of Health, because I think the weight of 3 county commissioners when all the other stuff you do and this health stuff is a real challenge. So I really like the value that
I wish we could take credit for it because it was that, because we're so weighted. What it was is we sat here and it took us 5 minutes to realize as new commissioners, we didn't have a clue. And we were the ones voting, and nobody else was voting, and the people that had no knowledge controlled everything. And we were smart enough to realize that couldn't continue.
well, so I commend you for.
That's true.
But that's an example, let's say, as a policy decision that you made, that's some piece of this here, so. So Jean, I will be coaching her a little on the side, but she comes in with a lot of knowledge about the work, so, thank goodness her coaching needs will match up with my gardening schedule, so I'll be out here.
Jeannie was one of the original people that flew back with Kim and I to Baltimore on the Achieve when we
Yeah.
started this whole process
Yeah.
of community health improvement, so.
Yeah,
Got
she's
some
been
deep
involved
training
for many
on
years. Learned all about policy system and environment, starting back then.
So if there's no other questions, we will kind of doing that, but after this point, Jeannie's going to be the connection, and you guys know where to, if I have any knowledge, add value to the conversation that I can add into this. So county health rankings, because I am the data person and trying to kind of just create a little bit of me. So I always remind people that this is a ranking, which means in any community, somebody's got to be 39th and somebody's got to be first, and that had been low. If we put Mason County across the nation with every county in the nation, because every county's done, we're probably in the upper half and higher with relative. So we always remember that, and it ties to the conversation that we talk about is it's less important to talk about the rankings, although this number up is something that creates a space for conversation, and know that the county health rankings is really just a tool for community conversation, and it's the numbers here. So the county health rankings, again, talking about data, since the University of Wisconsin does it across the nation, 50 states, maybe Puerto Rico, or I don't know if they're in there or not, and Washington, D.C., but they have to find data that is available in every state, and a lot of data is driven by state government as sources of information. So that sort of frames some of the data that are on here. I'm doing you guys in 101 when you're out talking with your citizens, going like, oh yeah, but it's not about the rankings. And it's about the data. So to me, it's much more interesting to compare actual data points, and if we're trending in the right direction rather than health rankings. And and a couple things on our health outcomes, why we saw an improvement from 32nd to 39. I'm not questioning that we're not doing a lot of good things, but they also changed the measurement for quality of life. That data source is through the CDC, Center of Disease Control, and it's through a BRFIS, Behavioral Health
Risk factors.
Yeah.
Say that again, please.
BRFIS, Behavioral
Risk
Factor.
factor, I don't know what the survey system.
Survey system or something like that, yeah.
Like that.
It's BRFIS.
BRFSS.
Yeah.
Yes.
It's through BRFIS, and BRFIS is done through collects data through phone samples across the nation. And because they do such a small sampling in Mason County, what they've had done in the past is they've added up 5 years of data to get a valid denominator and to do that. So they may have got. So, but because of the critical importance of the County Health Rankings Initiative, the CDC is paying for, and I don't know who, is paying for oversampling in every county on the specific data that are in the County Health Rankings. So we'll see that, so if you think about County Health Rankings used to be 5 years, and so if we're trending down in the right direction, and we were high here, low here, and the next year one drops off and the next one comes in to the data. So you see a slower rate of change just because you're averaging, you have those other years. This data point is an actual data point. So it picks up the end when we've been trending in the health direction of where we are, closer to where we are, and it gets rid of all that, I'll call it noise from the earlier years. So I want you to understand that's one of the reasons why I think it shows that we're moving in the right direction, because we're trending in the right direction, and our data, the ones, if you go onto the County Health Rankings with the asterisks, are data points that have done it. Same thing with smoking, which accounts, and the thing I talk about smoking, we still have 16% of our adult population smoking, but the gap between us and the state average is getting narrower and narrower over time, which is, it may be nice to cross over that path and have it go, but, so that's one thing that, to kind of point out in the data. On the clinical care piece, it's a real challenge for us to, in terms of numbers, to get any changes here because of the way they weighted, and I shared this when I was at the Public Hospital District number 1 meeting this morning, is one of their key indicators that they talk about is the ratio of primary care physicians to population. Because of the challenges in rural communities to recruit primary care physicians, our hospital districts rely more on mid-level, so physicians, assistants, and nurse practitioners, and those don't count in this number. So we always are going to be cattywampus, lopsided on our physician to population ratio, but it does not mean we have an access problem because of the strategy that Public Hospital District number 1 has had to do to be able to keep access there. But while I will celebrate, and on this, and if you go online, you can see the trend data, and is that preventable hospital days, so people that were in the hospital should have been discharged healthy and show back up into the hospital system. Those days are going down, and I'm sure at some time, not at this meeting, Eileen will come and share with you some of the strategies that the hospital is doing in order to get those numbers done. And that actually is, I think, the largest accounting for our change in that particular area. The social economic issues about education, poverty, I will share the importance because this is one, if you track us over time, we've been up and down, and there's so much waiting on high school graduation because at a time when we had the Robert Wood Johnson Foundation and the other work we were doing countywide, we had graduation rates up into close to the 80%. And then when the state budget came in, they cut all the funding out of education, then it dropped back down to 64, where we were rebuilding with Graduation Matters from that point. This is one over time that I see is, I can almost predict where it is by our graduation rates, and given in general graduation has to do with state budget and priorities, it's one that kind of, if there's no additional capacity in the community to invest in high school graduation, you're just at the whims of state budget. And we went up significantly, improvements in the physical environment, and part of it is due to the change nationwide how they measure water quality. I don't know if this is probably, it may change after the Flint thing again, I don't know, the change of how they're measuring it, but something's happening good because we got a perfect score in drinking water violations and how they used to measure that before we had some ticks in that category that impacted our thing. So that gives you a little bit of idea if you're looking at the county health rankings and people are saying, my goal is to give you a little bit more, so you're just not talking about the rankings, but you have a little deeper knowledge about sort of what's behind the causes, and then some of it's data stuff and the fluctuations, but some of it is good work that's happening in our community. Great. Okay. Is there any questions on?
So I have an interview with a university that's been contracted to talk to elected officials about the county health rankings.
Okay.
What should I tell them?
What should I tell? So I think, really good question. I think, so where I would kind of start is many public health departments are moving toward having a CHIP. And our CHIP was informed by the very first county health rankings. So you can see a strong connection between each of these issues and each of the categories, and what should help us see significant improvements when many public health departments, and Lydia can attest to this, in their CHIP are picking like teen pregnancy, obesity, very narrow perspectives. And unless you're thinking about all of it, that one sector, like the hospital cannot, and a physician cannot reduce obesity by itself. There has to be thoughtful work like we just talked about with the food bank on obesity. It has to be possibly some work with, I'll use the city and I don't know what the status is when you got the safe routes to schools to make it easier for kids to walk. So each of these problems are too complex to be solved. And the good thing about Mason County when you're talking about it is our community health improvement plan has been thoughtful to address the complex issues.
Not
That-
just a single.
Yeah, the complex. So that's where I would. That's where I would start the conversation. And also, and you may have some other things, Dr. Yu, to add into that, and to think that because these things are not, they're not quick fixes, that really we're just, we're looking for, what we as community are looking for are movements in the right direction, knowing it's going to be a little bit bumpy because funding comes, funding goes, we lose things, and we have to regather our ground and go for that. But in general, we're not losing ground in Mason County. I'll just say that there's not that many areas where we're skyrocketing in the wrong direction on this stuff. And then I think if you kind of look at and Joe mentioned it in his press release, the health outcomes are our current status now. And our health factors is the potential for our health in the future. So that if we got smoking rate downs, obesity, healthcare things, that we should see improvements in here. And I think, and the fact that we're having both of them decreasing shows that our future, we're moving in the right direction for our future, but we're already starting to see some little changes in the health of our current population. I surprised that it didn't mention, I didn't mention this, but this premature death, which is a measure, it assumes that everybody's going to live to 75, and every year you die before 75 counts as a year in the premature. So it counts up the total number of lost years for people that pass away before the age of 75. That's what that measure is. That actually, if you looked across the whole 6 years, I mean, they're not huge decreases, but that's one that every year we're decreasing in the right direction. And that's a good indicator. That's a high level indicator of all this other work that we're doing. So does that help you?
Yeah.
Do you want to add
And
anything?
actually, the reason it is so important to have this community health improvement plan in the community process is so many of the things that improve our health are behavior changes and things that as the community feels more free to talk about issues and begin the conversation, take the conversation to a different level, work on it community-wide, that is where we're going to see the changes. Individually, any of us that work in public health or an individual physician can't impact change. It's a personal decision. I'm going to stop smoking. I'm going to stay in school. I'm going to be more physically active. There's a lot of personal decisions, but what the community can do is help empower you and help make those things available for you, like making healthier food available, healthier places for you to be physically active. And I love the way this is set up, because as the different groups identify where there needs to be policy changes, this is where I see the Board of Health really being able to, because I'm talking to the entire Board of Health, and me, can't dream up every policy that needs to be changed. But as a group, when something is identified, we need to do it. Is there something we can do as a Board of Health to make a policy that helps move that issue forward? It's just numbers, it's just ranking, and I understand it. And every time our numbers improve, I still just get a little yippee in there.
We do too.
Yeah, I mean, it's nice, and then, next year, if our ranking goes down a little bit, we won't yippee as much, but I would love to see actually the health rankings compared to all the counties in the nation.
That would be nice.
And because I think, in reality, our rankings are much better than the 29th out of 39, because Washington State is actually
One of the top.
one of the top in the nation. So, it looks like, but as an aside, one of the things that I do is I look at our death certificates, and I was just remarking the other day, looking at January and February, how many people we have living in this county that live to a ripe old age and die in their late 80s and 90s. That, I guess it just didn't dawn on me before, but I actually had ages separated out. And I go, oh, wow, and it's just a huge group that are, 101 or 102. One of our prominent citizens just died recently at 101. And so there must be something going on in Mason County.
The health rankings, with your question that you asked, also is we have bought into this from the first year they came out, and we followed them very intently and learned about them. And I don't know if you remember, we did a road show in the whole community where we actually went out and met at fire stations and went out to different clubs and gave presentations to help people understand what the numbers meant. We may have to do that again.
I think you
Yeah.
do,
I
because
think you
it
do
gets a
too.
lot more press than it used
Yeah,
to,
yeah,
and people get, even are less, understanding even less.
Right.
And, what you shared today, I mean, it was all verbal, so
Yeah.
will I catch it? No.
I'll write this up for you, okay?
Yes, great, send it out to all.
Did you get it, my those minutes there?
Every word.
That's what I'll add. So if you want, I will type something up that's a summary that maybe give all the sports some talking points.
That would be great.
Okay. Okay.
And if you're on Facebook, go to Movie Mason Forward, and I'll start feeding little pieces.
Oh, that might be, yeah.
Great idea, and then we could forward them out,
Yeah,
yeah.
feed those out.
Okay.
That's why we hired her, because I don't have a cell phone, and we need to move into the 21st century, Kim.
So now I guess it's time for the health
Thank you.
officer report.
Yes. Actually, and just bringing us back, a few months ago, I came to the board talking about, opiate use and opiate deaths, and just been giving that a little bit more thought. And Mason County has a unique distinction of being #1 in the state in terms of the rise in between the years 2002 to 2004 to the years 2011 to 2013, where our rate in terms of how many opiate-related deaths we have just shot up. And so we had the highest rise. Now, that meant 14 deaths, okay? So-
Highest rise in the state of
in
Washington?
the state of Washington.
Okay.
So when you look at the raw statistic, Mason County just jumps at you. But when you look at the total numbers, and I talk to the docs, they say, well, I haven't seen one. There's not that many, but there were 14. In our county, that's a lot. But so what you also see is it's a tip of the iceberg, because not everybody who has an overdose dies. And so I've continued that conversation, and I'm taking it out to our docs. And because one of the issues was availability of treatment for people who want to get off their opiate use. When you look at this issue, there are a lot of different factors, but there's also a lot of different ways to deal with it. So one that we, as the Board of Health has already done, is doing the prescription drug take-back program. We implemented that a few years ago now. It's been successful. It's been successful at getting some prescription drugs off the street. but it has absolutely no impact on heroin availability and heroin use in the streets. So there's a lot of prevention work that continues to happen, and Shelton Schools and the health department have been partnering in doing a prevention effort. So that is ongoing. So this whole issue of medication-assisted treatment for opiate abuse is one that has been kind of hanging there, and it is one where I'm taking the conversation to our physicians, first down here, because we have an organized medical community out of Hospital District 1. We're going to start there and talk about whether or not, what we do need. There's also the discussion with our criminal justice system, and they're interested in talking about it as well, because one of the biggest reasons why people end up back in jail is because of drug use. So, so this is one I just wanted to give you a little update that we're continuing to take that conversation. At some point, this has got to be a community-wide discussion.
Dr. Yu, what do you mean by the conversation? What does that physically look like when you're having that conversation with your doctors?
I'm having a show and tell. I'm bringing the statistics to the docs. We're doing it at a medical staff meeting. I'm talking with 2 doctors that are interested in heading this issue, becoming like the drug czar, kind of, for lack of a better word. When we talked before, we talked about the fact that there was really nobody in town who was prescribing medication to get somebody, who wants to get off opiates. There really wasn't anyone who was prescribing.
And Medicaid wasn't paying at that time.
And Medicaid was
Now it
not
is.
paying. Medicaid is now paying for it. There are now doctors who are interested in prescribing that. We still do not have access to a methadone clinic. That's still in Thurston County and Grace Harbor. We still do not have access to syringe exchange, but that's available in Thurston and Grace Harbor. And I'm not advocating for any particular strategy, just making sure that access is available. So beginning that conversation means that our doctors need to recognize that it is something that they want to actively participate in, because they have to get a special license to do that.
Doctor, go ahead. Doctor, I'm always uncomfortable with the whole conversation of it, but I attended a meeting recently where they were talking about this and talking about Mason County and how bad off we are because of it, that the ones that need help here can't get help because we don't have a place that dispenses it. So literally they're expected to go and travel and get out there to Thurston County, to the facility they have there, and make it happen, and they just can't seem to connect the pieces. Derek Kilmer is looking at trying to put some pieces together with that. I guess mine's not even a question as much as it might be a statement. Like I said, I'm uncomfortable with the whole thing, but just because I'm uncomfortable doesn't mean that we're not supposed to do something. So I guess what I'm saying is, if you see an opportunity or something, please let us know, because it appears to be a serious shortfall to where we can't service the ones we have or get some of them off because we don't even have availability for them to do it.
Right.
Even though there's a downside with having that clinic. I'm finding that out too. Having that clinic has a lot of downsides.
Right, and it really depends on what our community decides is the kind of clinic that we want.
Well, I was
Makes
excited because in Kitsap County, they did get a grant,
Yeah.
a sizable grant to help with the Suboxone. So
Mhm.
I think
They're
that
starting to
North
get it.
Mason area will benefit greatly from that, because
So-
that's where a lot of our,
Yeah, and it is also the conversation that we need to have between the chemical dependency treatment providers and
what
the
kind
docs.
of
Well,
treatment.
can I step in? You may or may not be aware that the Behavioral Health Organization
Mhm.
for Mason and Thurston County is now organized,
Mhm.
looking for some advisory board members, and would love to have some Mason County representation. I'm on the governing board. Use me.
Mhm.
If there's a policy need that's paid for by Medicaid, use me.
Yeah, so my plan was to use you.
Okay, good.
It's funny, because I guess what you're hearing, you know, even though
Yeah.
this is not a commission, regular commissioner, you're hearing that there's two
Yeah.
commissioners that are, you know,
Yeah.
like I said, even though I'm comfortable with it, that are saying,
Yeah, we need
To be
move
honest,
Yeah.
it is identifying a physician that is willing to champion it, and I think we're going to have one. That it's not just me, it's a physician locally that's actually practicing, that's got office hours where he actually can see patients and is willing to take a half a day a week to maybe work in a clinic where he can provide this with the support of a chemical dependency program. So a physician cannot do it just by himself. They can,
but what about the outlet? Because even if we do all that, I understand that a lot of them are getting diagnosed, but there's nowhere to go or nothing to do here.
It-
And they
it-
don't do too well getting on a bus to go get it.
no, it would be something local. It would be something, but it needs the connection, not just, you know, with the doctor prescribing. The person who wants to get off drugs needs a support system. And that support system is usually provided by the chemical dependency treatment providers, who heretofore have not had a doctor to prescribe that pill. So that's what we're trying to do, is connect. And hopefully, we will have some, but we're discussing this in the first week of April at the hospital. We're going to start talking about it and go from there. You know, whatever we come up with, I recognize there's a big component, because I look at the zip codes of the people who use the syringe exchange in Thurston County. It's a lot of them are from the North End.
Yeah.
And I'm actually surprised. I thought it was mostly from the Shelton area. It's actually, no, it's more from the North End.
Well, I can tell you that by all the ones in the ditch. Uh,
And in the parking lot.
Yeah, but now, what about, is it possible that it can be done through our local pharmacies, or is it, because I've never heard anybody say that's even an option, that it has to be through these clinics, and they set up and they go in line and they pick up their morning dose, and
You're speaking of methadone, she's
I'm
speaking
speaking
of
of
Suboxone, an
Suboxone.
entirely different thing.
And I think methadone, starting up a methadone clinic is a completely different discussion.
Mhm.
And, but in terms of preventing recidivism in the jails, the methadone program has been shown to help it. I know, but the thing is that, you know, we have the methadone program in Thurston County and one in Grace Harbor County. I am surprised at how fast the clinic has really just taken off in Grace Harbor County, because they just started that about a year ago.
and you're right, I'm talking methadone, and that's why
Yeah.
I'm so uneasy about the conversation.
But I
But
will
again-
tell you that all pharmacies carry Suboxone,
Yeah.
so.
But
that
You need a
it's just-
prescriber and doctor.
But if you have a prescriber, they can do it though, and
Yes,
they can.
yes, but
They have to
it's
be
also,
followed.
the best success is when you have that support system around you.
With them.
Is that also a daily, or is it?
No.
No.
It is a,
But they're on it for a long time, for a couple of years and weaned.
The Suboxone is a daily dose.
Yeah,
But
it's daily, but
take it.
you,
You take it at home.
yeah, you
Okay,
don't,
yeah.
You
It's a
don't have to
prescription.
go in. So, more to come. I think there's, you know, I'm constantly kind of injecting it in there. And yes, I mean, part of the conversation I've been having included Mark Friedman with the behavioral health, because there's just a lot of chatter, is what I call it, going on right now. It's very positive chatter, which I've never, in 10, 11 years that I've been here, it's never risen to this level of interest chatter. And I think before we introduce anything, it has to be, at the very least, for people in the community to remain neutral. Just like you say, I'm uneasy. Yes.
but you're neutral.
But you're remaining open and remaining neutral, as opposed to no way.
You know, I went to a behavioral health conference 2 weeks ago, and I had a great opportunity to speak to a lot of treatment providers. And I asked many of them to discuss this very question about total abstinence versus
Medication.
medication assisted recovery. And I heard more than once, you can come down on that however you want.
Right.
But if the difference is if a life is saved or not, are you really going to say no? And so,
Yeah.
I mean, you know, I had one gentleman say, my preference is abstinence only, but I'm not going to deny a man, a person, an opportunity to recover if it
Yeah.
means taking this drug.
There is a, Dr. Fontinos from out in King County, that was the training I went to a week ago, is willing to come down to Mason County with Mason County information, and for us to have a community meeting about it.
Good.
And I will arrange it with her. It's some data, but it's presented in a format that's easy for the community to look at and understand. And it is asking that question. If this was your son or daughter and they need to have medication to help them get off the drug, are you going to deny them? And it basically comes down to that, because not everybody can go cold turkey. Not everybody can just turn
And
it
that's the
off.
one thing about quitting. You fall down, you get up, you dust yourself off, you do it again. Then you fall down, you dust yourself off, and then eventually you just keep standing. But-
And hopefully, the other end of that is you teach them to walk so they don't fall. And it is, it's just the whole spectrum. But if we, you know, so it's something that we will need to bring back. We definitely will need to come back for a policy issue at some point.
This is that chemical, we had that conversation about 6 months ago or so,
Mhm.
right?
Yeah. So the only other thing I wanted to bring up is that in 2 days' time, it's World TB Day. So just as a reminder to folks that tuberculosis is a disease that's been with us for at least 17,000 recorded years. It's been found in fossilized mummies everywhere. It's still here. And when you think about all the disasters, and you think about all the disease outbreaks and all these horrible things that have happened where people have died, there are 3 people in the world who die of tuberculosis every minute.
Wow.
So if you think about that, and our numbers in the United States, our numbers in Mason County aren't that big. But this is one where I continue to have a passion and I work on it, because if I don't work on this issue, not on work time, but you know, in my personal life, on a global way, we are never going to eliminate tuberculosis. And it's almost there. Our goal is 2030, just like Healthier 2030. The goal is to get down to 1 case per 100,000 in the U.S. by 2030. It is a very ambitious goal. I don't know that we can do it, but we're going to try. And there's a lot of things, but one is for people to be aware of whether or not they have a risk. And if they do, they need to get tested. If you think anyone who was born before the 1950s, before tuberculosis drugs were available to treat, could have been exposed. You know your grandfather had TB and he lived in your house, your uncle had TB, your dad had TB and they lived in your house. You could have been infected as a child. And as you're a baby boomer now and you're getting older, you're on immune modulator drugs because you have arthritis or you've got diabetes that's out of control. These are all risk factors that make your tuberculosis actually act up and cause disease. So for everybody out there, it's good to know, did I get exposed to TB? And what is my status? And if you already know and you've been tested and you don't have TB infection, yay. But it's also something, you know, we talk about Zika virus and talk about travel-related concerns. I have concerns about people who travel on medical missions to different parts of the world where tuberculosis is a big burden. because they can become infected and infected with drug-resistant tuberculosis. And it's very, very hard to treat. So if you just think about tuberculosis in the next 48 hours, there are a lot of stories out there about healthcare workers who've become infected or missionaries who've become infected. And we do our public health job. The hospital helps us a lot, identifying people that they think might have tuberculosis, and we act on it right away. But I think everybody needs to just be aware of their own risks and talk to their doctor about it. And that's it.
Okay, so I guess we're down to policy, and this is a continuation of our January meeting, and kind of maybe just our purpose.
Joe, do you want to hand out the pen?
Sure.
So, re-listening to the January meeting, there was some discussion about what kind of policies, what do policies look like. So he's going to hand you out a couple of handouts that he pulled together. One of them is called Health in All Policies, Key Points. We try to make it brief, and I don't want to give you volumes of information, but just some highlights. And though this community has been operating, the community itself is doing a lot of Health in All Policies type work, I don't think the board has ever, that as far as back I've looked, ever actually made a policy stop talking about we want to do Health in All Policies. It's just sort of happened as people became more aware of it. And so there's some bullet points there about what that means. It's basically just when you're thinking about different policies that are being done, to think about how does this affect the health. Our whole CHIP process and everything we're doing around that sort of comes from this whole Health in All Policies background, and so we do think about that. We're talking with housing about health, we're interconnecting environmental health, and we're looking at different school things that are going on and how does that affect the health. We're looking at transportation. So we've sort of been doing it, but I just wanted to give you kind of just an overview of that this is something a number of years ago that across the nation they begin to talk about, thinking about policies and how it affects health in a community. And I'm sorry I didn't get this to you earlier. We weren't exactly sure kind of how we wanted to move ahead on this. But then the next one is for you to read later, is just about a guide to policy. What is policy? There's little p and big P. And a lot of times political or electeds think big P because those are the regulations, the ordinances, things where you're doing an actual thing. But really, little p is also Board of Health would be doing a lot of things that are more like plans or comprehensive plan. Comprehensive is big P. Little p is more like the departments, the agencies, and their programs that they're doing different things. When you did the breastfeeding resolution, a resolution is a little p often. And so every time the board does a resolution to support something, like today, the resolution around Public Health Week, you're doing a little policy, a little P policy. It's not a big law, but it is something that helps change. Then the next thing talks about high impact versus low impact policies. We got this years ago when we were working with Achieve and the NACHO and talking about the different kinds of policies and how to make change. And there's policies that can have very low impact on population health, and there are other policies that can actually be more impacting. And so when we look at things with our CHIP, we're going to give that information to those groups so they'll begin to think about if there's a policy they want to bring up to the board, they're going to think about what's really going to make a bigger impact. So an example was we actually met the person who started the seatbelt laws, and he talked about how it started as a simple conversation in a community. It was very fascinating to hear how long it took to get the seatbelt law in America. So it can start with very simple little things that are being done. The hospital got very involved with this a number of years ago when we started working on it, and they made changes to their vending machines. They made changes to their meetings as to what the food, and I've been to their meetings, and so there's always healthy options there. Those are little Ps. Those are smaller changes, but they impact the overall change in health in an organization and then ultimately in a community. Our schools, we'd love to do vending machine changes in our schools. My daughter got, in 1 year's time, unbelievable amount of cavities because of a soda pop machine, and she wasn't raised on soda. So those kind of things can help. You know, they don't totally regulate, but they're just making it a healthy option, you know, with all of the different supports. So that kind of talks about that, gives you a little idea. And then Joe put this together, did a great job. Thank you, Joe. The last page has basic examples of policy creation and implementation. He gave a quick example of the governor policy of strive to eliminate health disparities by race, ethnicity, and gender. That's actually considered a policy, though sometimes we might not think that as a policy, to help Washington State become the healthiest state in the nation. So a lot of times the Board of Health can hear something and get behind, like I just saw it right here, talking about the substance abuse and working as a community together, and the Board of Health can make a statement of saying, we want to move forward. I actually heard it from both of you. We want to move forward in seeing what we can do to help this opiate abuse problem that's going on in our community. That is actually considered a policy when it comes to making change in a community. So I just wanted to give you that as a little, I hope it was helpful, as kind of a little help in that. And I think you had some things too, didn't you have, Debbie, about environmental?
Yeah, the last Board of Health meeting, we talked a little bit about solid waste. Solid waste is just a little bit different in our programs than food and drinking water and some of those other ones that come through the authority of the health officer. Solid waste comes to us through the Department of Ecology. And when I spoke to Lydia and Dr. Yu, it occurred to me that because they didn't know all of the steps and the different levels, the Board of Health probably didn't either. A lot of the environmental health programs are enforcement-based. So that's a whole different ball of wax. I didn't print up a bunch of stuff, but all I did was print up the index for our state WAC 173-340 that regulates solid waste. So all of this stuff has all their sections. We're not going to kill that many trees. And from that, we come to our county code. Now this I have printed up because I use it quite often. Title VI in our county code is solid, well, it's many things, but 6.72 is our solid waste regulations. So we've taken from the state, we go to the county code, and then we have a section from our Board of Health many years ago who passed policies. We will be coming back to this Board of Health in the near future, because the state regulation, WAC 173, 350, 340, and 350 are changing. So we'll adopt those by reference and then look at what we want to change, if we want to change anything in the county code, and come to the Board of Health for policy. And then Joe, because he's new and he's just been so great and full of energy, developed a litter reduction tips, ideas, prevention techniques, and education statement paper for us. And it's really cool. There's some things for youth to do, some things for local businesses to do, a homeless education and events to have to help. And the very first thing he had on here just caught my attention. It said, in your landscaping, if you trim back trees and brushes on side of the road, a well-groomed landscape is less likely to contain litter. So we have our county road crews doing this out in the county. And I was sitting in a meeting where people asked, why do you do this? I wish I'd had this before that. I could have said that. And then in some research that was done, they said that 1 to 2 pieces of litter in an area, most people did not litter. But if there were 3 to 4 pieces of litter, the number of litters increased to 41%. So these are just some of the things out there that we can work with, that we can use, that we can do. But I thought I'd just give you the very quick overview, and because that was something that was talked about at the January meeting, bring it back today, and
Great.
more as you'd like.
Joey, you're on social media?
Yes, he is.
Oh, yeah.
He's going to be our social media person, yes.
You'd probably send that to Shelton to the top. I'm sure he'd love to just feed those things out once in a while.
Yeah, I reviewed his site and stuff, so
Kevin Schmelz.
sure you'd like that.
That's a good
Okay,
idea.
we're
May I
kind of,
make a comment?
oh, yeah, quick.
The interesting thing with a lot of policy is sometimes it can just be a statement. And it can be overwhelming to think, oh, I've got to create all these policies, but sometimes you just got to take the statement and then let stakeholders and stuff get involved, and they can kind of direct where it goes. For example, in Pierce County, they said we're committed to reducing tobacco use in the home. And one of the reasons why was because the fire marshal had said that that's the #1 cause of death in house fires is because people are smoking in their home. So then they built this task force, and the task force came up with an idea of, let's start out a little campaign by just putting something on movie theater, in the movie theaters, and that was how they started. So it all just started with just the fire marshal coming forward and saying, hey, I have this problem, and then the board of health says, okay, well, we're committed to helping you with that problem. What should we do? And they said, well, let's create a task force. And the same thing happened here with the governor's policy, was they said, we want to eliminate health disparities. And then, so they said, well, what should we do? So they created a council. And then that council got together and started creating all of these plans of action. And then they said, let's support community-driven approaches. Let's enhance first step programs, promote equity in state. And then from there, it's like, okay, how do we do that? Then you start getting people like me, go out and talk to stakeholders, go out and get businesses involved. An example for the litter, I think another thing too with policy is sometimes you're afraid it might affect businesses, but sometimes businesses want to get involved. So litter, for example, sending the subway, guess what I saw one subway was doing? They decided, you know what, let's get rid of paper bags, we could probably save money, and they came up with this holder. And it was using 90% less paper than the bags, and it's kind of cool. They just had this little holder, they stick the sandwiches in there, and people walk on, and so that helps reduce litter, and then Subway can say, hey, we help reduce litter in our county, come support us, and then people do, support that cause. So a lot of times just a little statement is all that's needed.
Thank you. So it's getting late, and I know and in the interest of time, I would like to have the public give a comment if she wishes.
She does.
Hi, public.
Hi, public. I'm Marilyn Vogler, 420 East Poplar. We all know what Flint is, and you referred to it earlier. Since I was a little girl, I learned from my granddad, who was a builder, that if I got a drink out of the tap, I never turned on the hot water. I turned on the cold water because the hot water would dissolve nasty things in the pipes and I'd get sick. I don't know if that's true or not, but we're seeing now things being dissolved in pipes. USA Today did a survey of schools and child care facilities that was reported, I think it was KUOW, on KUOW News, and someone called me to say, Mason County has lead in its drinking water, would you follow up on it? So I looked into it. There were 3 schools in three places in Mason County that turned up high lead levels. The Washington State Highway Patrol, the Seventh-day Adventist Church School, and another, what must have been child care center. It's on the website of USA Today, and they have an interactive map. But I was curious because this is not something that's tested for when the water leaves the city or when the water comes up out of the ground, the way you test a well. It's something you have to test inside the home when you turn the tap on, because it's picked up by the water as it goes through the pipes and the plumbing. So I called Public Health this morning and I said, okay, is there some place I can draw some tap water and take it so they can test
for lead in my home water. My home was built in 1931, and I think it's still got the original plumbing from the way it behaves. I was told no, that public health, and if I'm given the wrong information, I'd love a correction, that public health checks for bacteria and something else, and they send it off to Thurston County.
The Public Health Laboratory.
Yeah, but the person I talked to said they didn't think even Thurston County checked for lead. And it seems to me, since this was USA Today, it was on local news, since people are concerned about it, that there ought to be some place individual households can take samples of the water from their homes to be tested.
Yes.
And so I'm hoping you can make that happen. Thanks.
Can you look into that and see what the options are?
Yes, there are
There are.
some labs, they're just not Mason or Thurston County.
They're
But
not public health laboratories.
Are they
They're-
something that we can contract with? They still have to pay for their own
Oh,
thing,
yeah.
but we can send it out through
quite
us? and-
expensive.
Advertise it, make it known so that people who are concerned can.
Well, it's a legitimate question.
Yeah.
You're right, there's a lot of old
Yeah.
pipes out here, guaranteed.
And you are very smart, having yours tested, Marilyn, just to have a baseline.
Yes, thank you.
Okay. I guess,
So you'll bring that back to us next month? Thank you.
I guess if that's it, we should adjourn.
Probably give her a call.
Yeah.
Diane, have you
Motion.
given anything about the community letter? Did you bring that? Oh, we
And I
have.
forgot
Yeah, we
about
have
You have it?
In our books, I don't know if
Okay,
the books
yeah,
got it.
because I had
So
sent
do we
it
need
to-
to talk
Well,
about that
I think,
first?
Are we not up there?
No, we're not off the record. I forgot about the letter. Sorry.
One thing I want to, because I read it a while back, I want to give a little bit of a reminder to everybody how it came about. It wasn't that Randy just wanted to cut the meetings. Remember, we went to empowering the board,
Yes.
and then we started asking the board for things to go on the agenda, and Scott was saying, well, you know, we got, because eventually we weren't getting anything. He says, well, why are we doing Mayport? Matter of fact, we were taking proposals, things, and just reading it to ourselves out loud, and that ate up time. We still used up all the time, but where we could have just read it ourselves, and that's one of the things I remember. I wanted to,
Well, one thing I know is that I don't want to meet just to meet.
yeah.
If we have something that we need to discuss, we could always call a special meeting if it was critical. But I know that this is a policy board. Oh, I'm sorry.
Yeah, I'm not, I just
oh,
gave
should
her a
have come in
copy.
your
Okay.
packet.
Did you get, it
There's
was
a letter in your
a letter
packet?
to the Mason County, Washington Board of Health.
I think she's got it right there, that's
Should have
it.
been- Well, I handed her mine, yeah. It
Right,
should have been in your
right,
packet.
right.
when we got it.
So,
Just more, you want to pass that down?
so basically, I think she's saying that we should meet more often than every 2 months.
But she was basing it on the health rankings numbers, and we've talked about that, and there wasn't an understanding in what that meant by the health rankings, so that was part of.
But I don't think that's why she actually believes, because I had a conversation with her
Okay.
at one point. She believes that we should be meeting on a regular basis, and, you know, we're the only ones that don't do it that way, and I don't know how accurate it is. All I know is, when we asked around with everybody, we couldn't fill the time up without just reading and doing things for ourselves, and we didn't want to have meetings, as you said, just to have a meeting, and we even allowed for us to be able to call for a special meeting if anything
Well,
popped
I
up.
understand that, but Commissioner Miller, if you spoke to her, can you please elaborate why she thinks we need to meet more often?
That's all. She just told me,
Well,
she just thought
and-
that we should, because we're the only ones in the state. She wants to be able to get the minutes quicker, and
I don't know if she realizes how much is being done by community. And in reality, what changes the rankings is not us sitting here at a meeting, but rather people in the community doing things. And so I don't see the necessity in having a meeting every month if I don't have a policy that I need to be addressing, I guess is
no,
my position.
I agree. And I want to clarify, I talked to her through text.
Yeah,
Text.
so,
Yeah, it's not
and
public.
Who are you
I
talking
don't
to,
know
Randy?
that
The
she
lady in
realizes
Texas.
Oh, okay.
what is going on with Mason Matters and all the community involvement. I don't know that all other counties are like that. So,
I've invited her to make phone calls and to talk to, but she wants to, according to her statement, she wants to keep things digital so that she can keep record.
Well, we can't respond this way. I mean, I'm sorry.
Yeah,
and if, I don't have a way of getting back. This doesn't allow us to get back to her.
You can go on the blog and actually type something is the only way to get
If I sign in
Yeah.
and make a
Right.
password.
I can give you her contact information.
Did you talk to her, Debbie?
Not about this, but she,
She has another issue with,
lots of other issues and records requests and,
This lady, Vicki
Yes.
Fitzpatrick?
no.
no, no.
Deborah Fitz.
Deborah Fitz, okay.
Down at the bottom.
I got this right.
Yeah.
Okay.
So I don't feel that we should meet every month just because she wants us to, I guess.
I'm not prepared to make a motion for it.
And I can say as the staff, keeping up with every month is just over our capacity at this point. I mean,
And there
It
is
was
so
very
much
hard.
work being done already.
I think the new Mason Matters work and them bringing things to the board, you know, at some time, if there seems to need to be more, then that's, the community will be
Right.
informing the board that we need more board meetings to get things accomplished.
Madam Chair, I move we adjourn.
Second?
I'll second.
Meeting's adjourned.
Thank you.
Can I get your contact information again? Because